What do you see when you look at a map? Do your eyes go to the places you know, where you live, work, or go to school? Did you know maps can also tell you about your health? Research increasingly tells us that where you live has a strong influence on your health. Your zip code can matter as much or more as your genetic code. Place matters. The Community Health Endowment works to make Lincoln the healthiest community in the nation. We wanted to know how place matters here in our community, so we began mapping many of the factors that influence health. Mapping health factors is not a new idea. In the mid-1800s, London was gripped by a cholera epidemic. While the conventional wisdom thought cholera was an airborne disease, Dr. John Snow thought otherwise. He mapped each death attributed to the disease and found them concentrated around a single water pump. When he tried to warn people about drinking water from the pump, they ignored him. So he took a bold step. He broke the handle off the pump and ended the epidemic. Like Dr. Snow, the Community Health Endowment is using maps to get personal with Lincoln to provide data and insights that will enable community members, activists, business people, service providers, and policymakers to take bold steps toward a healthier Lincoln. And you can use these maps too. The interactive maps on this webpage can help you learn more about the state of health in our community. Life expectancy is one of the best indicators of a community's overall health. At 80 years, Lincoln as a whole is slightly above the national average. But to get a more detailed picture of our community, you can drill down and see the life expectancy rates for each census tract within the city. At this level, you can see a 30-year difference in life expectancy between neighborhoods just a few miles apart. To find out what may contribute to this difference, use the layering function to select from a variety of health issues and influencing factors to look for patterns, causes, or other related information. Turn on and off layers that show how poverty has changed since 1980. View where cancer deaths and asthma cases have been reported. Track childhood obesity rates, or access other health-related characteristics. Tracking these factors at a neighborhood level allows us to look at health beyond healthcare and how it's influenced by our homes, our neighborhoods, our economy, and more. Looking at Lincoln through these maps also shows us how neighborhoods vary greatly and helps us understand the unique needs and opportunities in each area. Using these insights and working together, we can take the bold steps necessary to become the healthiest community in the nation.